Thank you. What I'm going to try to do might be better described as a whirlwind tour of social skills training, because what I want to do is to try to give you a little bit of background or feel for how it works, a little bit about what the research says, all within half an hour in order to allow enough time for Eric and Tom, true experts in social skills training and novel applications, and from San Diego, to present on their approaches and the findings from their studies. So if I sound like I'm going a little bit fast, sorry about that, but I'm just trying to squeeze it all in. To begin with, social skills training goes back a long time, at least 50 years. You can go back even further. An article I remember reading in The Behavior Therapist, although I've never been able to find the citation, but I read it about 20 years ago, actually pointed out how all of the components of social skills training are actually incorporated in one place or another in the musicals of Gilbert and Sullivan. So it may well be that social skills training, as we think of it, goes much further back than 50 years, but more like 100 or 80 years or somewhere along those lines. There's been lots of contributors to the development of it. Salter, Albert Bandura, who developed the whole theory, or really articulated the theory in terms of social learning theory more than anybody. More modern contributions to social skills training, say in the later 60s, it began to get packaged as an intervention, used to change behavior. At first, things like assertiveness, and then began having applications to things like basic conversational skills. And then people like Bob Liberman, very important mentor to me, and I know Eric Granholm, Dr. Granholm, who will be talking next, also worked under him. He and Chuck Wallace and folks at UCLA did some of the most important work in terms of packaging of social skills training, and in particular types of packages. It's not the only package, but it certainly is important, because in order to deliver an intervention, you need to package it in some kind of a standardized fashion. So, I mean, in a nutshell, social skills training, what is it? It's an approach to helping people improve their functioning, in particular improving social relationships, or the quality of interpersonal functioning, but also in terms of improving their self-care, their independent living skills, what's broadly construed as functional outcomes in people with severe mental illness. And it's an approach that does so by taking complex behaviors, breaking them down into their smaller constituent units, and systematically teaching people those particular units, giving people positive feedback, lots of encouragement, using lots of demonstrations and the like as ways of helping people gradually over time learn these skills. And I'll get into the specific how-tos of skills training in a minute, but most critically, it's an approach to teaching better functional, social, and self-care behaviors by breaking them down into steps and practicing them a lot. I guess sorry, I thought I was already on that slide, but you have it in front of you. Let's just talk for a minute about the relevance of social skills training or social impairments in people with schizophrenia, although this is also applicable to people with other disorders as well. Work that I've done and many other people has often looked at the effects of skills training on people with either schizophrenia or severe and persistent psychiatric illnesses such as major mood disorders, bipolar disorder, where you often get social impairments as well. But the impairments are most prominent in schizophrenia. We know that social skill impairments tend to be stable over time in the absence of skills training types of interventions. We also know that between 50 and 70% of people with schizophrenia have significant impairments in such basic social skills as conversational skills and insertion skills. We also know that social skills are strongly related to the functioning of people in the community, functioning along the lines of what I described earlier, amount of social contact, quality of social relationships, quality of self-care, and independent living skills. And of course, these are some of the most fundamental ingredients or core defining aspects of the illness of schizophrenia. Impairment in functioning is one of the criteria for the diagnosis. And in my experience, these types of functional impairments really go to the heart of schizophrenia more than anything else, certainly more than the symptoms do. So I kind of said, oops. in terms of, well, what is social skills training? I've kind of described this a little bit, but it's the systematic teaching of interpersonal skills by taking complex skills and breaking them down into smaller steps. And then the teaching of those steps through a combination of demonstration, practice, positive feedback, more practice, more positive feedback, and suggestions for improvement, and then home assignments for people to practice these skills on their own. Now, in talking about social skills, why don't we just drill down into that a little bit more and talk about some of the different types of social skills. And broadly speaking, you can break social skills into either 3 or 4 different categories. You have the nonverbal social skills, gestures, facial expression, body orientation, and interpersonal distance, and the like. Then you have what are often called the paralinguistic skills. This refers to the quality of the voice, the tone, the loudness, the pitch, the appropriate variation. Often the combination of the nonverbals and the paralinguistic skills really convey the meaning of what the person is saying, sometimes even more strongly than the content. So if you take the classic assertiveness situation, somebody butts in line in front of you and you say, please don't get in front of me like that, or please don't do that. I mean, even though you're asking the person not to do it, you're not conveying it in a manner, in terms of your paralinguistic features, that's consistent with the message that you don't want the person butting in line in front of you, as opposed to saying, please don't get in line in front of me. Even if you were to keep the verbal content exactly the same, the tone is very different, and so the meaning and the interpretation by people is very different. And then you have verbal content. And verbal content refers to the words, the choice of words, what it is that's actually said. And may have to do with specificity, if you're referring to something that you're happy about, that you want to let the other person know about, or something that you're unhappy about. But in the teaching of social skills, often what we will do is to take the verbal content of particular skill areas that we're focusing on and to break it down into core elemental pieces. And then we will often combine those elemental pieces with either nonverbal or the paralinguistic skills to form a little recipe. And there's no one way of doing it, although it's useful if people have done this before so you can kind of learn from their ways of breaking down skills. But let me give you just a few different little recipes for basic common communications. So this is expressing positive feelings. And so the idea is you want to get it into a limited number of kind of components. So looking at the person, so you make sure that they've got your attention, saying what they did that pleased you, and then saying how it made you feel. So very basic, 3 different steps. You could divide it into different ways, but the idea is to break it into something more manageable than as if it were all just one complex step. Or expressing negative feelings, which is a little bit more complex, but you have looking at the person and speak firmly. We kind of put that into 1 step, even though it's really 2 steps. Say exactly what they did that upset you. Tell them how it made you feel. And suggest a way of then preventing that from happening in the future, or to correct the situation.